Good evening, everyone. Dr. Alan Christianson here with you, and excited for tonight's discussion. So this is our iteration of Office Hours Live, and tonight's focus is going to be all about deprescribing, about lowering or for some even coming off of thyroid medication. This is a really cool topic, and I'm glad to do some depth here and talk with this with you guys. And I got a couple of case studies too. Many of you sent in information about yourselves, and I mentioned I'd pull 3 of those out, and I did. So we'll talk about those too and grab a few more general questions. Oh, I saw someone saying no audio. I think it looks like my audio is working properly. Might double check your speakers, please. Anyone want to give me a thumbs up on their audio there if it's coming through okay? I can see some people on video. Anyone on video want to give me a thumbs up? Okay, I'm seeing a lot of thumbs up. A lot of folks are seeing it coming through. Yeah, whoever just said no audio, please double check your speaker settings. Must be there. Okay, I will pause a bit, let some folks come in. There's a lot of folks jumping in right now still. And I'll get my slides going too here. Wonderful April evening. Northern Minnesota, we just had a lot of snow last day or so, but this coming week, we're supposed to be thawing. So that's exciting. We should start seeing the ground sometime soon. Okay. Share screen, get my slides up. And there we go. I'll adjust this a little bit here. Okay. So a whole lot of folks coming on still. I will start real quick. We got a nice group here this evening. Got a bunch of you all on, and many more coming on in the moments. I will grab some questions at the end, and you're welcome to raise your hand at any point. I'll see the hands that are up, and I'll grab those in order and cover those and get as many as we can. You can put stuff in chat too, and I always look at the chat. I'll do that as much as I can. I'll always look at the chat afterward too. And the chat, I'll reply to some things when I can, but I'll always look at these topics and figure out topics to have for future discussions and also like new blog content and whatnot. So yeah, always put your stuff in chat. If you do want to ask a question directly, use the raise your hand feature in Zoom and I'll see that and I'll call you out in order. Call you out, that sounds bad. Call on you in order. You call someone out when they're in trouble, right? Nobody's in trouble here. I hope I'm not, but no one else is. So yeah, this is a cool topic. So deprescribing thyroid medication. This is a rather new concept. You know, we've had quite some time to where we've thought that thyroid disease was about something that was missing. Like there was something that your body needed that it wasn't getting enough of. Like there's not enough gas coming in the car can't work well. And the simple intuitive story was that we put more stuff in and it's all okay. So whatever the problem is, we can fix by putting more stuff in, that stuff being thyroid hormones. But there's been just these radical new insights over these last several years. And it's changed my thinking a lot. And it's been an awesome thing to see. Thinking before about it being a matter of needing to put more stuff in, the conventional world was slow to really to do anything and oftentimes did no treatment, and many suffered for that reason. In natural medicine, doctors were quicker to act. They were quicker to put people on treatment, and they often got better. And the puzzle now, some ask, is that if it's not about medications, how come is it that I've often seen people better with that? Well, in natural medicine, no one has just done medication. You know, they've always done dietary change. They've always done lifestyle type things. They've always done nutrient support in various ways. And over a lot of the years, I don't know, a lot of us as doctors thought that we did all that stuff because we knew it was all good. But a lot of us ourselves even thought that the medications were probably a big part of the success. And if someone got better, we probably attributed a lot of those benefits to the role of medication. But the data now is telling us that the medications don't do as much as we thought. But they're also telling us that lifestyle therapies, diet therapies, nutritional support, these things do more than we expected toward thyroid disease. So the new interpretation is that people did get better. That was a valid observation, but it was less so from the medication. And a lot of the other things that were done along with it had a larger role than we thought. So that's a general overview about this whole new era that's rolling out. We no longer think about thyroid disease as a disease of too little. And I got to say, there's exceptions to that, of course. There's those to where the thyroid gland is removed. And there are some to where it totally shuts down. Now, those are not as common. And stats estimate that somewhere around 90% of people who are conventionally prescribed thyroid medication are not in that situation. And those who are prescribed in the natural medicine world, it's probably even more than 90%. So many are suffering, but not because there's too little hormone there. We now know that there's some combination of this inflammation in the body. We know that there's some immunologic effect taking place. And it turns out that these things are larger drivers of the symptoms. It's more a combination of inflammation and not so much just a lack of these hormones the body needs, but an imbalance in them, meaning that there's the wrong amounts, the wrong proportions. And that's something that we can try to talk about as a blanket statement, but even that doesn't give it enough accuracy. There's different amounts and proportions of thyroid hormones in almost every tissue in the body. So we can think about the brain, the heart, the muscles, the liver, wherever else. And each little compartment has its own microenvironment of thyroid hormones. And when someone doesn't feel well, it's not that this whole bucket of the body has a hole in it and the thyroid hormones drained out. It's that there's the wrong amounts, wrong proportions in these various areas. So once we get this new idea, it becomes obvious how the solution is not a matter of pouring more stuff in, because it wasn't that there was too little stuff as the main problem. So it also makes sense why diet and lifestyle can be more effective than we thought, because these are things that improve the body's ability to fix itself and to balance those out. You know, we hear about T4, we hear about T3, you might hear about reverse T3. Well, these things are members of a very large set of things that we don't hear a lot about. They're called thyronomines, and we know of dozens of biologically active thyronomines. And we know they do stuff, and we know that their relative proportions matter. So the more the body can control all these little microscopic thyronomines and adjust their proportions, the better things all go. So now it makes perfect sense that diet and lifestyle can work. You know, if it was something to where the body needed something that it couldn't make anymore, that was totally gone, then yeah, you're right. Those things wouldn't do much compared to just putting that stuff back in. But that's rarely the core problem. And not just in the thyroid space, but the idea of deprescribing is an idea whose time has come. There's medical organizations, there's training about this. And what happens is that people get put on things that could have made sense at the time, but may not be needed on an ongoing basis. So in the thyroid world, how often, how likely is this as a generalization? Well, this 84% number refers to those that can take none or less and do fine. And doing fine, I've heard it said that fine is an acronym for what? Messed up, insecure, neurotic, emotional, but that's not what I mean. And I guess it wasn't really messed up, right? I don't use profanity, but so yeah, I'm not talking about doing fine. I'm talking about thriving. So these are folks that they no longer need meds. Their labs are fine and their symptoms are great. They're feeling totally fine. And in many cases, this is what shocked many people. They often feel better. This is part of it too. We're learning is that the medications coming in from outside the body not only do not replicate what would go on inside of a healthy body, but in many cases can disrupt what goes on inside of a healthy body. So this is the percent of folks that can do fine. And what makes me really passionate about talking about this is that's a big number already, right? Now, this comes from studies in which there's like nothing thoughtful done other than here's a timeline, quit taking your pills, have a good life. I'm not kidding. There's almost never thoughtful stuff done as far as diet, lifestyle, nutraceuticals. It's really just basic med reduction. And there's also not a whole lot of selection going on. Many people are candidates. Some people are even more likely candidates than others. And in most cases, these are studies in which, they're just pretty much taking all comers, cut out your meds, have a nice life. And with that little nuance and with that little support, it works well for a lot of people. So yeah, 84% can successfully reduce, and of them, about half can successfully eliminate. Now, we know those numbers are only better with some thoughtfulness and with some nuance and with lifestyle approaches. So I'm going to do a real quick overview about what the process looks like. We're going to go through our case studies, and I'll grab some questions. I want to have a lot of time for that. So here's the general idea about these protocols. And this is both from the published studies and from just personal experience and ideas that we think are relevant. The first thought is, are you a candidate? Is this for you? Is this something relevant for you? Now, there's not a lot of factors that make someone not a candidate, but there are a couple, and it would be irresponsible not to mention those. So, got to have a thyroid. We actually had a case at Integrative Health of someone who, by their best knowledge, did not have a thyroid, but she actually had enough left, it grew back and started working again. Now, that's not common. That's not common at all. So by and large, you've got to have a thyroid to even think about this. Having said that, even if you don't have a thyroid, a lot of these same steps can help you do better on the hormones you need that come from outside of you. So not saying you can't do better. And in many cases, you may need less and you may see improvements of that. And that's a great point too, I want to mention. Winning is not getting to none for all people. Winning is less. Every degree of reduction is a win. It's more control your body has and more capacity for your body to self-regulate and take care of itself. And this is one facet of your health, but this is one facet of your health that affects so many things. So if your body can do 20% better at regulating thyroid hormones, then your stress response, your basal metabolic rate, your detoxification, your tissue repair, your emotional resiliency, all these things are going to be markedly improved. So every degree of a win is a win just across the board. So having a thyroid, and that includes not having some stuff that was zapped and may not be much left to it. So not having had radioablation. And then also not presently pregnant or nursing, just because there are some changes that could be too much for your body's hormonal balance at that point. So yeah, first thought is, are you a candidate? And if you are, the next thought is, are you ready? Is this a good time for that? Now, I'll talk about some considerations about being ready. And I'll also kind of push back against myself to say that, a lot of things that we do in life, we're never totally ready for. And sometimes if we wait till the perfect time may never come. But there are some things that may be obvious that might make it easier to work around. So one thought is, are there any medical issues that might make this a lot harder for you right now? Things that can be fixed and taken care of. Are you anemic right now? Are there some marked GI issues at present? So yeah, if there are things that have been identified that you're aware of, that you're in the works to fix, that seem like they can be fixed realistically, and also to push back against that, there may be other symptoms or issues that may improve and may do better after the whole transition. So it's not always a case of waiting until everything is perfect. But if there are some obvious issues that might make it worse, that can be resolved, you might want to clear them up first. It can make it go easier for you. Another thought is, are there some big transitions in life coming up? Are you about to move? Are you about to change careers in some way, starting a new job? Is there a surgery coming up or some major medical procedure? Have you got some big travel plans? By and large, you'd rather do this in times in which there wasn't a whole lot of chaos going on. So think about a time frame and think about roughly a 6-month block in which there's not major scheduled life events coming up as far as a good time to undertake that. You want some leeway for that. For the general time frame we'll talk about is about 2 months, and that's what comes from the clinical trials. Many people take a little longer than that, and some choose to pause and hold out at some time frame. So what I encourage is thinking about 6 months. If you've got a nice window to where there's nothing too major going on, that's a great time to undertake that. So yeah, are you ready in those sense? We want to think too about, how are your nutrients? How's your body's nutritional status? And this is stuff that's important, but this is stuff that you can really address from the very onset. You wouldn't have to wait until some perfect time to start, but these are things to take into account at the beginning. I'll briefly mention the relevance of iodine If you've heard me say anything at all ever, you probably heard me talk about that. I won't spend too much time on that tonight. The relevance of macronutrients. There's a lot of data about this. So I actually talked to a group of doctors last night about T3. It turns out that your body changes how well it uses thyroid hormones when you're really hungry. So when your weight is going down, even if you're losing weight in a healthy way, that will change the thyroid hormone balance. So you want to be at a time in which you're not embarking upon the metabolism reset diet in that moment. You can be on maintenance, that's fine, but you don't want to be actively losing weight during this transition. And also you want a balance of macronutrients. There were some studies I talked about last night showing that even if you're getting enough food, but you're getting very little carbohydrate, that'll also change the thyroid hormone balance. So yeah, macros are fats and proteins and carbs, and none of them are evil and none of them are magic. They're food, and they're all things that we need certain amounts of. So you want a balance of macronutrients. You want your weight to be stable. And just a bit about the relevance of iodine, just one quick slide on that. Some of the newer studies now about deprescribing are also recommending the importance of eliminating iodine and keeping it low. And they're showing that they know this can really exacerbate a great deal of autoimmune thyroiditis. And what they're seeing is that by avoiding the most obvious sources, people are more successful with their process of deprescribing. And I was talking to some people yesterday, also in an earlier webinar, and yeah, the hidden sources are there and they're real. Someone wrote in saying how she had a bunch in her cosmetics and she identified that. She was able to eliminate them. And that was one of the biggest steps for her. It was that and her salt. And her doctor wanted her on thyroid medication. Now she's fine. She's totally stable. So yeah, don't underestimate the importance of that. I won't spend too much time on that, but it is critical. So be aware of the guidelines of the Thyroid Reset Diet. It will make all this go much better for you. You know, something interesting I heard about relative to stressful situations and, you know, how we frame circumstances, how we experience trauma or stress. If you think about like how your legs feel during a really hard workout, you know, and if you're someone to where you're used to exercise and training, you may have a lot of positive framing around that. You may feel, yeah, I worked out good. I trained hard today. This is a good thing. But imagine if you had that same feeling like at 2 a.m, you know, you wouldn't have positive feelings about that. You'd think, what the heck is wrong? I need some medical care here. There's something really off. So a lot of symptoms are really how we frame them and about our expectations. I also heard about veterans who had predictable tours of duty and veterans who didn't know how long they would be staying for, or they knew that they might be sent back out even though they weren't planning on that. And it turned out that the likelihood of post-traumatic stress related more to how much they could predict their time frame, more so than how difficult their experiences were. So yeah, a lot of our experiences are how we frame them and how we anticipate them. So I want to really frame this whole thing properly. I've heard a lot of folks to where their transition and their deprescribing has gone from more than they needed down to 0 in a couple of months, and they felt better and better the whole time. That totally happens. And I've also heard from other people to where they had a rough go at it. A lot of their symptoms came back and worsened, and then they stabilized a few months into it. So all those things are possible. And the most typical scenario, though, is that the symptoms that may have initially been better with thyroid meds, those are ones that may worsen during this process. But I want to make a big distinction between symptoms that are progressing and those that are not progressing. So if they show up, they kind of pop up into your experience, and here they are. That's like a non-progressive symptom. Now, a progressive symptom is you kind of notice it, it gets worse, it gets worse, it gets worse, it gets worse, and it keeps on going. Now, that's not as common. And that's a situation in which it can be appropriate to, you know, pull the cord on the bus and say, hey, I want to stop right here. And that's a really big part about the whole deprescribing process. Now, this is always something you would undertake with the acknowledgement and the interaction with your prescriber, but people are encouraged to have control over stopping or reversing at any point in time. So you should never feel like you're on a train and you can't get off. You should always know that, hey, you've got the option. And sometimes that by itself is really powerful. I remember a roommate of mine long time ago, she had asthma, and she would have, this was before insurance was more universal, and she had all these major medical expenses from having to go to the ER for all these asthma attacks. And one very smart doctor told her, I think we were in medical school then, told her that, look, why don't you drive to the ER and just park in the parking lot, catch your breath for a few minutes. And if you calm down and feel better, call it good. If not, you're right there and you could walk right in. And she told me that there was many cases in which she could drive there and stop and just feel okay. So knowing that you've got control, knowing that you can immediately go back up to the last dose you were on, or just stop the whole process, sometimes that by itself makes it a lot easier. You know that you're not committed, that you can make any decision that you wish. But it's really important to recognize that there's a difference between rebound symptoms versus emergent symptoms versus baseline symptoms. So rebound is the main thing I want you guys to get. What rebound means is that if anyone takes thyroid hormones, their body makes less and their body gets less responsive. Now, whenever they stop that, it takes a little while before their body responds better again. And during that little while transition, they may feel worse, but they're worse in ways that are not going to last. Your body makes this much, you take a pill, now your body makes that much. Now you stop that pill, your body's going to come back up again, but it's going to take just a little bit. And during that time, suddenly now you're making less on your own, plus that pill is not there. But eventually you're going to pop right back up to where you were before that started. So this is the time in which those rebound symptoms happen. You can feel worse than you were on medication, and some even feel worse than they were beforehand. But it's really important to recognize that for what it is. It's not always lasting in that time. And I'll talk about this with some of our case studies, but your labs are the same thing. So labs can rebound during this early stage, meaning your TSH may shoot up in those first few months. And some can see that and panic and say, oh my goodness. Now, if that were a score that were to persist, or if those were symptoms that were to persist, they would be totally valid concerns. But please know there can often be a rebound and they may not really be persisting. So expectations, here's the likelihood. Now, again, this is the studies in which they're basically told, quit taking the pills and have a nice life. So there's not a lot of nuance or support or framing or expectations or lifestyle or nutrients or whatnot. And in those cases, what they saw was that of those who successfully discontinued their medications, about a third had symptoms that were showing up, but were not progressive. They kind of showed up and hung out. And about a third had no real symptoms, but none had these major progressive symptoms. Now, of those who were able to reduce their medication but not come off, some did have symptoms that progressed. And generally, what they would do is, as they would progress, they would stop at that level and stay there. And the symptoms would tend to calm down again. About 2/3 had symptoms that were not progressive, but a big chunk didn't have any symptoms there either. So many people have a pretty easy go at it and don't really have major symptoms. Many have symptoms that show up and are not progressive, but not very many have major symptoms that show up that are progressive. And again, these are studies in which there wasn't a whole lot of smart stuff that was done. So this is about symptom expectations. I just touched on the idea of diet. The other facet of this is nutrient support. And I could spend a lot of time about all these individual micronutrients, but I put these things together to make that easy. Basically, to help transition, you want to help the body's deiodinase pathways, and you want to help the body's thyroid receptors, and you want to help the rate of thyroid cell regrowth. Those are the big three goals. And that's what these two products are for. I really made these like as a blank slate. I chose exactly what had good evidence for doing those things, helping the body better use the hormones, better manage them, and better repair the cells. So hypothyroid support, T2, T3 converter, and these would go along with baseline micronutrients in the daily reset bundle. If there's also thyroid antibodies present, that would include thyroid antibody support. But basically, this is what you'd want to do for covering all those bases to help your body do better during that transition process. Now, what does that process look like? Well, again, from the studies and from personal experience, in most cases, that's a reduction of about 25% every other week. Now, I want y'all to hear this. This is kind of like a speed limit on the road. You won't get busted for driving below 55, right? But you don't want to go much over it. So that's how this is. You can go as slow as you want. There's no rate that is too slow. But this is about as fast as you would want to go. And many actually did well on this pace. So what are the best options for medication? Well, the medications you're on and you do well with is often a good fit. But in some cases, people change and have their prescriber do something different just for the purposes of de-prescribing. Now, these are my first and second picks. I like T4 in this context because it metabolizes really slowly. And we'll talk about more why that's handy. And I like low potency pills. So this is the lowest potency thyroid medication that's available right now, is a 13 microgram. The cool thing about that is when someone is de-prescribing, their prescriber can give them oodles of a low potency pill. And they don't need to get a brand new prescription every couple of days and they need a new potency. They just take a smaller number of pills. So the idea is you take a large number of pills or whatever number you need to get your dosage. And then as you taper, you reduce the total number of pills taken per day. That's a whole heck of a lot easier than having a lot of different prescriptions to have to manage and refill and not need all that much of. So yeah, the simplest thing is to do that. So what does that mean? Well, let's say that somebody takes about, for easy math, let's say they're on natural thyroid and they take somewhere around a 90 milligram dose. Well, if they already have some of those tablets, that's fine. But for transitioning, they could get a large quantity of 15 milligram tablets. And so 15, if I do my math right, that'd be 6 of those would equal 90 milligrams. So they could take 6 a day to approximate their initial dose. And then they could go to 5 a day after a certain time frame, 4 a day, 3 a day, 2 a day, and so on. And rather than have to get, all these odd potencies, many of which aren't even made, you can make more incremental changes by having a large quantity of low potency medication. And again, people should know they always have the power to pause at any point in time, reverse at any point in time. That's totally fine. So what does this process look like? Here's kind of a detailed sense of laying it all out. The first thing is having a clear plan and then choosing a start date. And with that, it's a matter of thinking about, if you're ready, if there are not too many crazy things coming up. But again, just know that sometimes big projects, there's never a perfect time, and sometimes maybe better or worse than others. But yeah, just balance those two ideas. About 5 weeks is a good time to check in with whoever is guiding you in this, your prescriber, and get a sense about your overall progress. That's a time in which symptoms are probably going to be peaking if they're present. So this is a great time to get some feedback and get some understanding on what you're feeling and what's normal, what might be worrisome, what might not be. This is a time in which it's always between you and your doctor, but I don't really push people to retest at this point because your scores are not going to be reflective of your status. They're going to show goofy stuff that's part of the rebound. Your brain is commonly going to be just begging your thyroid to work. And your thyroid, when it does start to work again, it takes a little time for that signal to calm down. So your thyroid can work faster, but that signal takes like 2-3 months to recalibrate. So in the thick of it, your scores are going to look goofy and they may not be significantly goofy. So about 12 weeks into it, that can be a time for rechecking and following up and going smooth enough, then another 12 weeks past that for the same thing. Afterward, routine care and general maintenance. So that's kind of a good time frame to think through with one's prescriber or guide with that. So to recap, as you think about this, just think through these steps. Are you a candidate? Are you ready? Have you got your dietary steps in place? And biggest factor is really the being low enough in iodine, having healthy balance of macros. I wrote the Thyroid Reset Diet about more than just the iodine. It did cover those other points, but yeah, follow those guidelines. Have your nutrient support in place. Have your expectations in place. Think through what might show up for symptoms, how you would feel about that. And what can happen is that many do wish to come off, not just because of the idea of, no longer needing the medication, but because in order to feel better. And many are surprised that when their body does work partially or completely by itself, they feel better than they did even when they were taking more medication. And the old paradigm of thyroid disease as being a lack of thyroid hormone, that wouldn't make sense. But the new paradigm of thyroid disease being an imbalance and inflammation and autoimmunity, it makes perfect sense that the more your body can do, the better you can feel. So those are part of the real goals behind that and the expectations. And the time frame, that 2 months is as fast as you would go for the deprescribing part, but you can take more time. And in terms of being back to a steady state, that can be a couple months even after being off. So those are all possible. And remember the odds of the symptoms, they were things that showed up for about a third of the people. Many didn't have them. So it can go both ways. And we'll talk about case studies in a moment, but just to let you all know, you do have the option too of talking to me in person. I can't prescribe, but I can give more guidance on what that can look like for you and just walk you through other steps, other readiness, things that might hold you back, and questions about that process. Doesn't matter which state you're in or which country you're in even. Happy to help out. Okay, so a couple of case studies. So I've got 3 of these queued up. And everyone who did email said they would be here. Hopefully they will. We'll see. Maybe, maybe not. First up was Bobby. And let's see. Bobby, if you could raise your hand if you haven't just yet. Let me see if I can find you here and unmute you and let you talk a bit. Okay, so if my participant list, and some people have raised their hands. I don't see that Bobby is one of those. And okay, they are alphabetized here by name. A lot of folks will use like a different name on Zoom than their personal name. I do see a Bobby R, and there's Bobby R's hand up. So cool. Love it when a plan comes together. Okay, Bobby, I'm going to ask you to unmute and lower your hand, and you're welcome to speak with us. Are you connected there?
I am.
Hey, Bobby, how you doing tonight?
I'm doing well, thank you. How about you?
I'm doing really good. Thank you so much. So thank you for sending in your information. And I read through that. I just put a few highlights of this up here. And you mentioned overall that that your blood pressure was high one time when you tried this. Your TSH went up when you lowered it in the past, but you were down to 15 milligrams of NP right now. Do you want to tell us any more details about your journey?
Well, yeah, I mean, my main thing was not to be on medication. I didn't think I had a lot of symptoms that I know other people were having, other than what I mentioned in terms of difficulty in losing weight and difficulty sometimes with sleep. But I never felt like I had symptoms from thyroid. Yet after all my journeys of seeing doctor after doctor after doctor, everybody wanted to change my dose. And that was like the first thing. In fact, I had mentioned that I saw you before COVID, and that whole thing got messed up because we weren't allowed to be a part of each other's life because no Zoom
right.
In South Carolina. And so I went to a new doctor here in South Carolina. And that physician wanted to put me on weight-based dosing and increased my dose significantly from 90 to 120. And I kind of got upset with that. And then I went to another doctor and he told me, okay, we'll go back to 90. So did that. And then we didn't have much success. So I just decided, and I was so happy you were having this program tonight because I decided to de-prescribe myself. And I went from 90 to 30, and I did 30 milligrams for probably about 2 months. And then I went down to 15, and I did 15 milligrams for about a month. And then what happened, and I don't know if it was a coincidence or not, but Labor Day, September 2022, I was just sitting on the couch and I knew something was wrong. So I took my blood pressure and it was 210 over 180. So I went to the emergency room and I didn't know if it had anything to do with the medication or it was just coincidental. But they've never found anything wrong with me, and my blood pressure is back to normal. So now, so I went back on my 30 milligrams, and now I'm on 15, and I have one more week of 15 milligrams, and I'm going to go off. And so this is good timing for me.
Something you said I noticed in there was about just that we're assuming that your TSH had gone up before when you had stopped this or lowered it. No, I didn't have that.
I didn't wait. No. I did not wait 12 weeks. So
okay,
it's good advice, and I'm definitely going to do that.
So one thought, always communicate with your healthcare team. That's important to keep people in the loop, but you can go as slow as you need. And the other trick is that people can do half tablets as need be. And sometimes those last few steps can be ones that people take more slowly. Like one example people will often do is you can do half tablets and do a pill every first day, every second day, a half tablet every third day. And some will do that for the course of a couple of weeks, and then a half tablet every other day, and then a half tablet daily, and then start skipping days of a half a tablet. Now, with natural thyroid, the one thought is that skipping any more than a single day becomes like pretty jerky, meaning that the amount of T3 is very erratic from day to day. So you can go alternating days, but that's as far apart as you can go. We'll talk about those who are on T4. It's a little different, but yeah, overall, that's been really as expected. Think through those general ideas about, of course, the dietary recommendations, the hypo support, the T2, T3. Those are things that can be useful for those needing to be on treatment, but they're really targeting the exact same processes of helping your body retake its control again and kind of like get its reins back again to regulate those sorts of things. But yeah.
Any thoughts on the red light therapy?
Red light therapy. Yeah. You mentioned that. There was a couple papers from one group in South America, and they had these phenomenal sounding results about red light therapy regrowing thyroid tissue. This is probably, I'm trying to think, this is probably like 2015, 2014 or so. And I thought, heck, this is cool. I'd love people to just, let's get these lasers and let's get them going and let's make this happen for people. A couple of follow-up studies were done afterward and didn't really seem to pan out. So there's a lot more to red light therapy than those studies. But as far as thyroid function specifically goes, that's all I've seen to date. So I can't think of any bad side of it. But for a while, we thought there was some very promising data about it regrowing thyroid tissue. But yeah, that just failed to replicate. So yeah.
Okay. Thank you.
You're welcome. Good luck, Bobby, and keep us posted. Let me know how you do.
I will. Thank you.
All right. Muted you again. We'll get a couple more here. And if there's time, we'll get a couple questions too. So next up is Brenda. And I will take a look. I don't see a Brenda on the attendee list just yet. A Bren, maybe? I'm seeing a nodding head. Okay. I'll unmute you in just 1 second. You mentioned having Graves before, being given T4 for metabolism, being on Synthroid right now. Let me just have you chat for a bit and we'll talk more about these things you'd written. So you should be able to unmute. If I click that full enough, you got
Very
it.
Very good. Yes.
How are you doing tonight?
I'm doing great. Thank you. Nice to meet you.
Likewise.
Yes, I was diagnosed in 2005. It was a highly stressful time in my life. I had severe anxiety, anger, couldn't tolerate the heat, couldn't have a bowel movement. And I went to my GI thinking, I have colorectal cancer. So he drew lab work, and because I'd seen him on a routine basis, and my TSH that he just happened to draw was 0.01.
Good catch.
And, so immediately, my PCP, you got to go here, you got to see the endocrinologist. So I was put on Tapazole. Slowly that dose was tapered. I responded extremely well. And I was off all medication until a few years later, like 2010. And at that point, I was diagnosed with Hashimoto's. and hypothyroidism, but still had the Graves antibodies.
Mm-hmm.
So I was put on Synthroid, initially 25 mics, alternating with 50 mics.
By any chance, do you know how hypothyroid you were at that point?
I do not think I was that hypothyroid because my labs were always within normal limits. The free T3, T4, TSH was within normal limits. So, but my antibodies were always off the chart. So I couldn't understand why I have to go on Synthroid. I don't get it, but it couldn't really be explained to me. It's just, this is what you have to do, and you have to take brand name Synthroid. That's all you can take. Don't take, anything else. So I did, and I've been on it ever since. I will be honest and say I went to another endo at one point, and I said, I do want to deprescribe. I went off these, and that was in 2016. So he said, sure, taper, go off. And I just didn't feel right. I was so nervous about it. So I didn't feel he was aggressive enough, where my other endo was extremely aggressive. So I went back to my other endo the next year. And of course, I was reamed out for going off Synthroid. So my endo just discharged me to the care of my PCP, saying I'm completely stable, stay on Synthroid 50 daily, ongoing. Your PCP can tweak as needed. You don't need to see me any longer. And I kind of felt abandoned, So I definitely, when I do skip a dose, I'll be honest, I skip a dose here and there, maybe every 2 weeks. I just feel, I got up too late, I'm not taking it. And I feel there's no change. I feel nothing. And my most significant symptom ongoing is fatigue. I just can't get rid of it.
Yeah. Thank you for that. So a couple of thoughts. So when this came on, you were diagnosed with the Hashimoto's, you'd had Graves before. It's really common to have both. And people can have to where they have Graves antibodies, most commonly TSI, especially along with TPO. So it's very common to have those things overlap, not unusual. So a couple of questions exist here. One of which is, can that make you feel not well? Can that cause symptoms? And definitely, we know that, yes, the autoimmunity by itself can cause symptoms, and that has nothing to do with you having too little thyroid. Now, back when you had Graves, too much thyroid totally caused symptoms. And something I want people to hear, you mentioned some symptoms like constipation. And a lot of people think there's these symptoms that are always hypo and these symptoms that are always hyper. Like if you got Graves, you're supposed to have diarrhea. And if you got constipation, that's supposed to be hypo. But it often doesn't happen that way. It's often the exact opposite. There's a lot of reasons for that. But yeah. So what do we do about Hashimoto's? How do we help with that? How do thyroid meds help with that? This was less clear back when, but it's very clear now. Medications don't help Hashimoto's. If Hashimoto's is along with overt bad total hypothyroidism where the gland is shut down, yes, can be a totally consideration. But for the autoimmunity itself, they have nothing to offer. There's large studies showing that they don't change the antibody levels or even change the risk of more overt hypothyroidism. They don't improve quality of life symptoms, but they do cause risks. There are drawbacks to them in those cases. So a couple more thoughts. You mentioned about missing some days. So two facets to that. So one could think that means I'm okay without it. With T4, it's so slowly metabolized. Even if you did need it, you probably wouldn't feel anything if you missed days. So I don't doubt that you're a candidate to continue your taper process. I don't doubt that at all. But no symptoms from missing days isn't proof of that either way. So it's just that it's so slowly metabolized.
But I was off it completely in 2016. I did taper down, and I just got nervous and went back on it without lab work, or anything, just a low dose. And that's when I went back to my endo, and he was upset with me. So
I would encourage those basic things for you, and definitely the antibody support. So that's targeting the antibodies, and the antibodies themselves, they can cause symptoms. The TPO and the antithyroglobulin, they can make you not feel well, and they can also have negative effects upon your health. But yeah, medications don't change them, but other things can. Nutraceuticals can make a big difference for those. So those things are all appropriate, and do talk to your doctor. I'm going to drop this in chat. This is a really detailed blog I wrote about deprescribing, and please share this with your PCP if he or she is not familiar with the concept, and it will give them some guidance and some more resources as well. My link real quick here. Okay. And I will put that right in our chat. This will be on the bottom of there. And yeah, take a peek, share some citations with your PCP and have them help you walk through that process. I think you can do really well.
Oh, great. Thank you so much. Appreciate it.
Nice to meet you, Bren.
Nice to meet you. Thank you, Dr. Christianson.
Okay. And last but by no means least, we've got Joanne here with us tonight. I saw you up. Going to ask to unmute. And let me do
Hello
the
there.
hand thing. Hey, Joanne, how you doing tonight?
Good, good. How are you, Dr. C?
I'm doing really well. Thank you for that.
Good, good. All right. So you want me to dive into my story?
Sure. And you've given me more detail. If you want to give a quick overview, it's all fine.
Okay. I started having issues back around 2007. I started losing weight. My hair started falling out by the fistfuls. I was tired. I didn't know what was going on. I went through 9 doctors in 9 years to try and figure something out. 2013, a chiropractor told me I had Hashimoto's. The 9 medical doctors I went to kept telling me I was fine and to stop wasting their time, basically. At one point, my TSH got up to 9.69, and my GP told me it was slightly elevated, nothing to worry about. So, yeah. Anyway, I'm all about deprescribing. If I don't have to take the medicine, I don't want to, of course. And a couple of my concerns are, I've had this for so long. The symptoms started about 2007, so it was a long time ago. And I'm told my thyroid is really tiny. I do the ultrasounds every couple of years. And I'm told it's small. It's 2 centimeters and it's heterogeneous.
Heterogeneous, yeah.
Yes. So I feel
fancy word for Swiss cheese.
Yes, exactly. So I've been on thyroid med for about 6.5 years. And 3/4 of a grain seems to be my dose. And you've given me my life back. At one point, it was around 2016, I could not function. I was a slug. All I wanted to do was sleep. I'd sleep all night and be exhausted all day. And I couldn't think, I couldn't function, I couldn't drive. I just was a mess. So the thyroid med really did help. Mm-hmm. And I feel as good as I did before all the symptoms started in 2007. So I am week 8 of a 12-week protocol on deprescribing. We are taking it very, very slow to go from a 3/4 grain down to a 1/2 grain. And right now I'm on the compounded from Foothills Pharmacy. We talked about doing Armor or something else, but we figured this would be big enough a jump and we'd be afraid to kind of change the med I was on because I'd been taking that for well over a year.
Yeah.
So the biggest symptom and the only symptom that I'm aware of without having done any blood work yet is the heart palpitations. So I got into week 5 and the palpitations just kept getting worse and worse and worse to the point I just noticed my heart beating out of my chest all day long. And to the point I couldn't fall asleep because it woke me up. It was just thump, 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 thump. So at week 5, I stopped. I was scared because the palpitations were so bad that I stopped. And I went back to my 3/4 grain for like 10 days. And that's when you had the last Zoom session and you were like, it's kind of normal. So I went, okay. So I dove back into the deprescribing. And since then, the palpitations are becoming less and less as time goes on. So I'm really happy about that too. I don't know if I'll completely get off of thyroid med because I've had it for so long. But you're giving me encouragement that I can at least lower my dose and that I shouldn't worry about the heart palpitations. So is there anything else I can do that you can throw my way?
Well, one thing to be aware of is just that with natural thyroid, that there can be more, it's harder to make it be as smooth because we can't really do the skipping days as much. Now, you're on the one type of compounded to where it probably is well made. You could even have them compound incremental potencies. They could even make some smaller batches for you. They could make smaller than 15 milligrams. They could make like a 5 or 10 milligram, and you could have small increments to make it even more gradual and more gentle. So that's an option too, because ultimately if palpitations are relevant, they're not from a lack, they're from a rebound. They're from the body really recalibrating. So the more smoothly it goes, the less dramatic those sorts of things would be and the less noticeable they would be. So yeah, so one easy trick in your case would be to have Dr. Espinal have there be compounded even like a 5 or a 10 milligram capsule and a large quantity of those. And you could use those to make this go even more slowly. A great point, though, I'm going to actually stop the screen share and just kind of come back in the room, so to speak. And there we go. A great point that you bring up, those deprescribing. Yeah, it's not always about getting to zero. The more your body does, the better. Every amount is a win. And also, it's not always a matter of you didn't need the meds. There's many cases where people they're totally candidates. They totally benefited. It was all just fine, but they didn't need them as much as long, or they needed less over time, or they needed none. And they've shown this too. They've shown that somewhere around a third of people that did need medications and were prescribed based upon all best indications, they just don't need them on an ongoing basis. Their body shifts, their body changes. So that's valid too.
Yeah, that's very true, because when I first was put on the medicine, this was well before the Thyroid Reset Diet. This was before I knew anything. So as you are painfully aware, I religiously follow you because I always learn something from every session, every email, every whatever. I always learn.
Oh, I'm glad to hear that.
I take away and use all the time. And that's why I'm where I am now, is because of you.
You understand something funny, Joanne? So whenever I'm like writing stuff that you're making videos, here's what I struggle with. There's things that people are coming in that haven't heard my stuff before, and I want them to hear the foundational things. But I'm also thinking, oh shoot, Joanne's going to hear this again. I want to say something new, but I got to cover the bases. So
no, it's fine. I love hearing it again because sometimes I forget things. Oh, which brings me to a question. Okay, last Zoom session, you mentioned you had your amalgams removed.
Yeah.
The brain fog thing. I toyed with that about 10 years ago, but didn't do anything. I was afraid because unless you go to the right dentist and the mercury fumes can go into your brain and stuff. Can you spend a moment on that?
Yeah. That's something I'm not as concerned about. Basically, how much they off-gas during the removal process is pretty irrelevant compared to how much they off-gas by just being in your head all the time, 24/7. Okay.
So it is worth getting rid of then.
Yep. Okay. I'd get rid of them by any process rather than not get rid of them.
Okay. Good to know. Well, thank you. Like I told you, you have been a lifesaver for me. You gave me my life back.
That's so kind of you. Thank you for that.
Thank you.
All right, let's grab a few more questions. I'm seeing a lot of stuff in chat, you guys. That's totally cool. I will go over the chat. Tomorrow, I'm going to go hang out with my parents for a bit. They're in the nursing home. I get to see them more often now, which is a wonderful thing. But in the coming days, I will look over the chat and see if I can't respond to a few or at least use those things for topics. So keep your comments going in there. I see a lot of stuff. If you do have a question, though, I see a couple hands up. I should be able to get to those. And I can probably get to 3, 4, or 5 questions maybe tonight. So if there are a few more besides those that are up, I probably could get to those. If not, that's totally fine too. Tina, you got the next hand raised. I'm going to ask to unmute and lower your hand and go for it.
Oh boy.
There you are. How you doing?
I'm okay. Thank you. I also enjoy hearing Joanne, by the way. She's here every time. And you do too. I have a question. I had a CT scan done for for other reasons. But what they found was my adrenal glands had no low density thickening of the adrenal glands, again noted without discrete nodule. So Googling it, I mean, I don't know what I came up with. Stress could be a factor for doing that. I really don't know. I would like to deep prescribe as well. Are my adrenals, is that fixable?
It depends.
You know?
Yeah, that's a structural change. And it may correlate with functional changes, meaning abnormal output from the adrenals, and it also may not. It's something that may not be significant. If the adrenal output is radically off in some way, then that can be relevant. And that's something that you do want to have stabilized prior to taking on deprescribing. So screen your adrenal function if you've not for some time.
I have never. I mentioned that to the endocrinologist once, and she was not enthusiastic.
You know, the funny thing about adrenal function is that it's often like a non-starter for endocrinologists. There are real adrenal diseases that are rare. And there's also this idea of adrenal fatigue, which is kind of overblown and misunderstood in natural medicine. But there are very real ways in which someone may not have adrenal disease, but still have adrenal dysfunction. So yeah, do consider screening for that.
Okay, well, I've started taking the hypothyroid support and lowered my dosage by 15 milligrams. So and also, if I take the hypothyroid, do I need to take also the T2, T3 converter?
It helps with the process. It helps the body with breaking down T4 and making all the proper metabolites out of that, including T2. So yeah, the better your body can do, the easier it all goes.
Okay. So you definitely suggest I wait to do the deprescribing because I'm already down to 60 from milligrams of Armour.
If you've not had any screening of adrenal function, it's a good thing to screen. Yeah, that's smart to do. Okay, thanks. There's actually, here, I'll drop a link in here. There are salivary panels that are available that can be self-ordered. You can just simply run a salivary panel and get data about how your scores are. And if they're reasonable enough, then you can proceed. I think that's even, yep, here's one right here. Here's a link I'll drop in chat. I think there's a couple of states in which you can't do home testing, but most states you can.
Do it in Maryland, I don't think.
Okay. So that may be a caveat, but yeah, just take a peek at that.
Okay.
All right. Okay. Have a good night, Tina.
Okay.
I just saw a couple of things in chat. I'm going to mention a few of those real briefly. Someone was talking about hyperthyroidism. I got to scroll back because that was there, and now the chat's going fast. I can't keep up as well. But basically, yes, hyperthyroidism, these particular ones, thyroid support supplement for Graves. Yeah, there's actually a blend made for that. And I'll drop that up in here. That's hyperthyroid support. And we actually made a Graves bundle. And that's right here. Yep, that's right here. Okay, I'm going to drop that link in chat. And one thing I saw too, just happened to jump out at me, asked if I knew about a book by Antonio Bianco, Beyond Hypothyroidism or Rethinking Hypothyroidism. He's a good researcher. I've collaborated with him before on work he's done for the American College of Thyroidology. And yeah, great resource, good book. He talks a lot about the idea of more so combination therapy as opposed to just T4. And he's written a lot of good papers on that. Very, very respected. For many who do need ongoing treatment and they lack a thyroid or have overt hypothyroidism, then there's certainly a good argument to make for including T3 in their therapy and not just T4. Yeah, great resource. But that's more so what it's about, more so rethinking it in the sense of not just giving T4 for those who need it, but also including T3. So yeah. And I would argue that T4, T3, it's both putting stuff back in. So when there's not enough stuff there, totally appropriate. But most cases here, it isn't that there's not enough stuff. It's that the stuff is not being used. It's that there's inflammation. It's that there's autoimmunity. That's the more common issues that are present. Let's get a couple more questions here. Karen, I see your hand up. I'm going to ask to unmute and go ahead.
Thank you. I had a couple of questions, but before I ask them, I just wanted to clarify those 2 new supplements that you introduced tonight. Is that primarily for people that are de-prescribing, or for even if you're on medication, would you still take that?
Yeah, definitely. Yeah, great question. So hypothyroid support. So these 2 together are appropriate for supporting the process of deprescribing. But yeah, that's not just what they were for. For those that need ongoing treatments, hypo support is really for anyone with hypothyroid symptoms. So if you're on treatment or not, but there's persistent ongoing symptoms, and to support the regrowth of the thyroid. Now, the converter is to help those who are having a hard time with their T3 levels, or they have low T2 symptoms, which include fat that won't break down, recurrent fatty liver, also slower basal metabolic rate. So they're to help the body use the hormones more effectively.
Okay, thank you. And okay, so my 2 questions were, I'll ask them and then let you respond. The last Zoom session, I thought
I'll do them one at a time in case my memory falters.
Oh, okay, well, I think you could handle it. But anyway, the last Zoom session, I thought I heard you tell a participant that being on thyroid meds increases your chances of osteoporosis.
Yeah. So here's the thing. I'm really candid with you guys. There are more and more studies about negatives of medications. And I've drafted a couple of papers talking about them. And I'm like, shoot, I debate about how much of that to put out. I don't want to scare people. I don't want people upset. I do want people to take as little as possible. And there are times in which there's clear harm from excess medication. Now, osteoporosis is one to where most of that data is about excess medication. I haven't seen a lot of data about medication in general. There are other papers saying negative things about medication in general, excess or not. So overall, it's good to be on as little as possible and have your body do as much as possible.
Okay, thank you. Okay, and then my last question was, I have seen on the website of clinics that do stem cell replacement that they list a medical condition that they treat with that is Hashimoto's. It said, like one I read said they give you an IV that treats the autoimmune part of it, and then they inject some into your thyroid gland. So what are your thoughts about that? Is that really, I mean, it's very expensive. So is there any research to support that it does help Hashimoto's?
Actually, the exact opposite. There is research supporting the fact that it doesn't. They're even further than what they're talking about. There has been work in which monoclonal cells have been made of human thyroid tissue that were reimplanted, but those with autoimmunity break down the new cells. So that was much more specific therapy as well. That was done in South America. The stem cell stuff, it's something that's kind of a Wild West, quasi-legal, may or may not still be lasting. Lots of big claims are made. No real evidence is behind that. There's a lot of concerns about those therapies even causing cancer growth, and there's reason to think that's possible. So it's stuff that I'm not really proud of that's happening in natural medicine.
Okay, thank you for clarifying that.
Welcome. Save your cash. Take a vacation instead.
Yes.
Okay. And one more from Carice. I don't know if I said that right. I hope I did. You can tell me. Go ahead, Carice.
Yes. Hi, Dr. C.
Hi there. How did I do on your name? Was I close?
You said it perfectly.
Oh, good. Thank you.
Yeah. Thank you for taking my question. So I got diagnosed with Hashimoto's back in 2004. And at that time, I didn't even pay attention to the numbers because, I didn't know, but I just, similar to one of the other ladies that talked, I was losing a lot of weight. I was having heart palpitations. I was like textbook opposite. So, the doctor at first told me, I was depressed and to go away. And then, she said, come back, and found out that I had Hashimoto's. So, over the course of the next, 5 years, I went through several different doctors. And eventually I was on a course of 125 milligrams of Synthroid. And then they added 25 micrograms of Cytomel back like in 2009. On the Synthroid alone. Yeah. So on the Synthroid alone, I think I still felt really awful. Like I felt, common symptoms like you're talking about, exhaustion, depression. I was inability to sleep through the night. I was having like extreme night sweats. And when I went on the Cytomel, I felt like I got a lease on life back. I actually lost weight. I went back to my normal body weight. I, felt exhilarated about life, happy. And so from basically 2009 until 2019, I was on that really heavy dose of the T3 and the T4, the synthetics. Then in 2019, it was just my regular doctor that said, I'm overprescribing you, and tried to take me down to, I think it was 112 milligrams of the Synthroid. And I was traveling a lot for work. I felt terrible. Like I was so exhausted. I couldn't function. I couldn't think. I, couldn't have a bowel movement, all of those things. So I decided to change doctors, and he put me back on that same dose that I was on before, the higher dose. And then in 2020 with the pandemic, I decided, I've kind of found you through Dr. Isabella Wentz. Uh-huh. And so I was like, all right, that's it. Like I'm home now. I'm going to commit to my diet and all of the supplements. And it was finally that I had a chance to really dive in. So, I went grain-free. I, took all the supplements, she suggested, and, really committed to a lifestyle, of healthy eating and relaxing and meditating and all the things good for me. But my health just got worse and worse and worse. And so then in 2000, it was the end of 2020, I got what they thought was like SIBO, and I lost more weight, and I wasn't sure like what was going on. And basically one of the gastroenterologists said, you're taking too much thyroid medication, which I didn't really give attention to, because my doctor was like, well, they're not functional medicine doctors. They don't know, they're looking at your TSH, which I think it was similar to one of the other ladies. It was like 0.001 or 0.0005, like very low. And I had no idea. Pause
for one quick second, just kind of share some, expand upon something you've been saying. A weird paradox is that I talked about how this is an issue of like the body not using it right and all that. Mm-hmm. There's times to where a massive overdose can like force things through in ways that feel better for a while. Mm-hmm. And a while might mean weeks or months or sometimes years, but never long lasting. Mm-hmm. So that's actually a really common cycle. There's those to where, and to their credit, they're being honest, and it's true. They do feel better. They feel normal again. Yeah. But it's in a way that's kind of forcing the body to do things that it fights against, and it doesn't last, and it does create harm and risk. And that's kind of what you're talking about.
Exactly. So then I started to learn about like the early onset of osteopenia, which I have. And so I had a naturopath in California, and she said, let's take you off the synthetics. Let's put you on compounded formula. So I thought, okay, that sounds like a good idea. So I did that. And for about 6 months, I was on the same, so I thought, dose of the compounded, the 125 and I think I had dropped down at that point to 13.5 milligrams of the Cytomel. And I felt great. I also started menopause, so I started taking bioidenticals at that time. And
I want to respect everyone's time, and I want to get to like one or two more questions if I can. So is there a question you're coming to? Or?
Oh, yes. So the question is, I ended up in the ER with heart palpitations, and I had adrenal failure. So now I'm off of all medication. And so I'm wondering if now, after all this, is a good time to deprescribe, because it's been 2 months that I've been off of medication.
I'm sorry, you're asking if you should deprescribe, but you're already off?
Well, I'm already off, but now my doctor's trying to titrate back up. So I'm wondering if now. That's a good question. I don't know.
That's the question.
Yeah, that's the question.
Yeah. this would be a great time if you've got autoimmunity.
Yes.
Look at my work, follow the Thyroid Reset Diet, use the antibody support, use the Daily Reset Bundle, do those baseline things. If you're at a hypothyroid state that's mild, consider hypothyroid support. But I would really discourage going back on meds if they weren't needed, and they wouldn't be needed unless you were overtly hypothyroid. And it sounds
how
like you
would I
never
know
were.
that? Yeah.
Your T4 would be way below range, and your TSH would be really high, like 10, 20, 50 or more.
Okay. And I can follow up with you to make an appointment, right? If I wanted to talk about that further. Okay.
You can. I'll drop that back in the chat so you guys see that. This is thyroidopinion.com.
Yeah.
There you go.
Thank you. Sorry to
thanks for sharing that. No, this is really good. What you brought up is important because many people are in this situation, and there's a lot of ideas in functional medicine that are well-intended and are based upon people's experiences and their short-term well-being and want the best for them, but they're not safe. There's a lot of ways in which people argue that you can ignore the TSH or that it doesn't mean anything. And they sound plausible, but it's just not true. And what you experienced, I've seen so many go through to where they do feel better for the first time when they're on a dose that's more than their body would need. But it's not because they really needed that. It was because their body was resisting it. So it can work for a while, but be a problem over the long term still, which is tough to wrap your head around.
Yeah. Okay. Well, thank you so much.
I'm glad you're in a better place.
Yeah. Thank you.
Happy to help further. All right.
Yes.
Let's grab at least one more if we can. Nancy's had her hand up for a little bit. So Nancy, let's hear what you got here. Go for it.
How often do you have these Zooms? This is my first time. I'm curious.
Welcome. Good to have you with. So I did office hours live, and that was a thing I did on social media like every week for a long time. And more people were saying they wanted something not on social media, and they wanted to do them on Zoom. And so I've been doing these at least once a month, not on a totally set schedule. I'm toying with doing some on social media. Actually, this is funny, but my social media team said that a time slot that more people are active is Monday morning, believe it or not. I'm like, really? I am. That would actually be a good time for me. I don't do stuff in the evenings that often. So I may do those again, but I will keep these up, and I'll keep these up at least about once a month, maybe a little bit more.
Oh, this is great. I actually don't live in the United States, but I will be moving back fairly soon because I'm getting to that retirement age. I'm interested in one of your supplements because I don't convert T3 to T4, and I'm on a medication here in Mexico that isn't available in the States.
Which one is that?
It's called Novotirol, and it's basically a combination of
T3 and T4.
Yeah,
I didn't know you guys had that still. There was one called I can't think of the name right now. It was it wasn't Tyrosine, but it was close. The name sounded like that. I can't think of that name. But we used to have one like that in the States, but it went by the wayside some years back.
Yeah, I do have a primary care doctor in the States, and I do usually go back for about a month in the summer. And he told me there used to be one like that in the States. Thyrolar was it. Leotrix was the generic, and Thyrolar.
Oh, okay.
Yep. Yeah, I don't like the generic, whatever the regular one is. Here in Mexico, they have something called Eutirox, which is the same thing. But it works better. And I just take a half of one of those with a little tiny piece of the other one. I do have the autoimmune, but I don't have severe problems. And my doctor in the States said, whatever you're doing, keep doing it. It's working for you.
Well, and a lot of people, T4 by itself is easier to get, and it's slower metabolized. So many people probably need T3, but they don't do well taking T3, and the combinations are harder to come across. But that's a great place for the T2, T3 converter. Helps your body make more use out of T4.
Thank you.
You're welcome. Good to see you. Welcome in.
Thanks.
All right. I was going to wrap up. Let me grab one more here. Here we go. Deborah, go ahead. How you doing?
Hi. Thanks so much. I enjoy these so much. I wanted to find out. I went to a new doctor recently. I've just been going through a lot of them. They always want. Apparently, it's very tough for me to get my T3 up to the normal range, and so they keep prescribing
up to the normal range or up to the high part of the range.
Just up to normal. I'm always below normal.
Okay.
And this latest doctor said, well, I think it's an issue of you not absorbing. But every time I'm at this dose, my TSH, right now it's very close to the hyper again.
Yeah, you're absorbing.
Dives.
You're absorbing.
I'm absorbing, which doesn't make any
You're
sense.
thinking about
right?
that more logically than doctor is. You're totally right.
And one of the things that she discussed, of course, along with this, was not to take any supplements unless it's at least 4 hours away from the time you take your thyroid. And but I'm wondering why. She explained that the T3 is, I'm taking the natural, the NP. I used to take the Naturopathic. I felt better on that. But she said, apparently and she says the natural is more, is higher in T3, higher than what the human thyroid would be. So
do you know your diagnosis when you started on the medication in the first place?
I do have Hashimoto's, and that's basically. I mean, when I first was diagnosed, I kept saying to the doctor, I had extreme fatigue, and I kept saying, I think it's my thyroid. He'd always only check the TSH. Of course, that was normal. And it wasn't until I had a CAT scan for something else, and they saw that my thyroid was very enlarged and that I had nodules. And that's when I got put on thyroid.
Meds may not help that part of it. They don't tend to help the autoimmunity or the nodules.
Right. But the T3, I'm wondering why I can't get up to the at least the normal range.
Super common. Super common. And that's what T2, T3 converter is for. Yeah.
The T2, T3 converter?
Yep.
What is?
That's
taking notes.
Yep. I'll drop that up in the link here. That's the new supplement, one of the ones I was talking about there. And it's for helping your body convert more effectively.
Okay.
I'll get a link to just that one. And I'll put this in the chat. And there we go. Yeah, in terms briefly about the T3 in natural thyroid versus your body, there's really not a perfect ratio. And the ratio in your body, it's where are you talking about? In the thyroid, in the blood, in the liver. Yeah, it's the ratio of active T3 to T4 in your bloodstream is about 3.5 to 1. So it's pretty similar to what is in natural thyroid. The amount of thyroid coming out of hormone coming out of your thyroid is about anywhere from 4 to 1 to 20 to 1. It varies a lot. Your body can adjust that. So in most cases, you secrete less T3 than you take, but you convert a lot of it. So the idea about it being a bad thing because of the ratio, that doesn't really make a lot of sense. I don't put a lot of stock into that.
Okay. I'm always concerned because my dad did have Graves' disease along with the eye disease. Common? Is that, she said you're not going to get the eye disease. I don't know how she knows that emphatically. You're not going to get Graves' disease, but isn't it a genetic thing as well?
Well, the tendency, this is kind of weird. The tendency towards thyroid disease in general is genetic, but which disease shows up is more random. So if and this is interesting, the genes that cause this, you said your father had Graves. Is that what I heard you say?
Right.
Yeah. So the genes are X-linked. So your mom had 2 X chromosomes. You got this one or that one. I don't know which. Your dad had 1 X chromosome. I know you got that one. So when a father has thyroid disease, a daughter almost inevitably gets thyroid disease, not necessarily the same kind. So I wouldn't say that you couldn't get Graves' disease or you couldn't have Graves' eye disease, but it's not really common sequentially to first have Hashimoto's and then have Graves'. That wouldn't be common. But yeah,
okay.
but genetically, it's very common to get thyroid disease, but not always the same kind.
Okay. What really bothers me, other than all the other symptoms, is that I'm losing my hair. My hair is getting so thin, and I feel like I'm a dog that's shedding.
Be sure you're not overdosed, and do make sense out of your iron status. That's often a huge factor for hair health.
Okay. They did do a ferritin test at one point, and it was quite high. Okay. I have been through a lot of stress, which I know you can lose your hair. I was in a major car accident a year ago and still dealing with injuries.
One more quick point, something else that affects hair. Iron affects hair in the extremes either way. High ferritin is usually a matter of fatty liver. That's the most common single driver of that. So do consider that too. Yeah, okay. Take a peek at my work in the Metabolism Reset Diet. It's all about fatty liver. And actually, a quick sneak peek, May, we're going to do a big free Metabolism Reset Challenge, and we're going to have a brand new app to go along with that too. So May would be a really great time to join us for a free challenge. And actually, I got a testimonial from someone today. She just sent this in. Her liver enzymes were 117, and she was seeing liver specialists. She went through the MRD, and they're now like 30. She's now just about normal again. So I don't even know if you have that, but that's suspicious when ferritin is high and hair loss. Yeah, just check into those things.
Okay. I just wanted to mention that when the doctor added, he wanted me to take 75 milligrams. I was on 60 of the NP. And in December, my TSH was, 2.160. And now it's like 0.08.
Yeah. So you're getting too much. And that can also be a problem for the hair. Too much can be like too little.
Yeah. It did raise the T3 to almost normal.
Right.
But that's a tough.
Your body's fighting. It's not you're not lacking at this point. It's not that you need more coming in. Your body is doing that on purpose with the T3. So it's a matter of resolving any sorts of inflammation that are present, helping your body use those things better. But yeah, take a peek at that. And the other option is that consult that I put up, that second opinion. You can put your labs up and we can dig deep as to what else might be driving this. But it's not a lack of thyroid hormone in this case, definitely.
Right. No, I just cut back myself. I went back to 60. So, yeah, and that was actually, he recommended 15 milligrams to add every day. I just did 15 milligrams every other day. So, yeah.
Let me grab one last one before the night is out.
Sure. Okay. Thank you.
You're welcome. Thanks. Megan's been being so patient and being so enthusiastic here. I can't stop prematurely. All right. I get it. Yep. Okay. Asked to unmute. Go for it, Megan. You're up. You're going to bring us in tonight.
Thank you so much. It's so nice to meet everybody. I'll be specific. Brief testimony. The Thyroid Reset Diet has been phenomenal. Realizing the iodine content in my diet was groundbreaking. And I miss my fish and I miss cheese. Okay.
Freshwater fish is a good option.
I know it's just got, just got to adjust to that. So the good news is the TSH has gone down organically through the diet from 12.9 down closer to normal range to 7.9. And the T4 is coming back in to normal range at the bottom end. Now, deprescribing and going in from the diet perspective, I want to move into a little bit of moo cow again. I really need my dairy. I've lost some weight on the diet. Most people need to lose it. I don't. My skin is still dry. I want to bring some dairy back in. I want to bring some more calcium in. I'm going to order the shake for the protein, and I am taking the bundle. Mm-hmm. Is it okay? Here's the question: to both move into the yellow foods and deprescribe with my doctor at the same time? Or should I remain super vigilant while deprescribing?
You'll probably get better success staying on the reset phase.
Oh, darn. Okay. That was just, yeah. And one last question about reset phase. Can I use my own baked bread at home?
You sure can. You totally can.
Even though it might come from a gluten-free bakery kit? I know the sodium content is really low.
Yeah, if you're seeing all the stuff in the kit and you know what's in there, I can't imagine that'd be a problem.
Okay, because it's really the processing part that makes you so reticent.
There's some vague stuff that goes on behind the scenes with commercial bread. And in some cases, they'll list out iodized dough conditioners, but some that don't list it still have weird stuff that somehow has iodine.
Yeah. And I had moved to a gluten-free manufactured bread from Udi's. That was great. But I've cut that back out now and brought my bread machine back out. So can I please have my bread?
Yeah, making homemade bread is totally fine.
Okay, cool. I'm a little happier. Thank you so much.
All right. Great question. Thank you for that. And we'll wrap that up. I see a whole lot of really cool stuff in chat, you guys, and I would love to address every single one of these right now, but I've got to wind down. It's still daylight out, but it's pretty close to my bedtime, believe it or not. Lots of great questions. I'm going to go through these, though, in the coming days and see if I can address some of them directly, but there'll be content based on all of them. So yeah, thank you for those in chat. And thank you again for the feedback. Those who are here for the first time, those who've been back and been regulars, I'll do this again very soon, and onwards and upwards. In the meantime, take great care of yourselves. Good night.